of Marked by COVID and an advisor to Protect Our Care. Congressman Matt Cartwright, who I know is voting right now, but will be joining us shortly, and of course, Senator Bob Casey. So thank you everyone for joining. Yesterday, House Speaker Nancy Pelosi and Senate Democratic Leader Chuck Schumer joined Protect Our Care kickoff for the Your Health, Your Vote virtual bus tour to make sure that voters know that healthcare is on the ballot in November. This virtual bus tour will make stops in 16 key states, starting right here in Pennsylvania. Today, we are releasing the 2020 Pennsylvania Healthcare Voter Guide to just remind people that healthcare is on the ballot. Trump and Republicans in Congress have taken every opportunity to sabotage our healthcare, pledging to rip away healthcare from millions of Americans, including 850,000 Pennsylvanians, to gut protections for pre-existing conditions and slash funding for Medicare and Medicaid, even in the midst of a pandemic. The Trump administration is now arguing before the Supreme Court, and if they were successful, he would take healthcare away from 23 million Americans, again, including 850,000 Pennsylvanians. Joe Biden and Democrats in Congress, including Congressman Cartwright and Senator Casey, are fighting to lower costs and better healthcare for everyone and to build on the success of the Affordable Care Act. For this third tour, Protect Our Care is bringing together important local voices from all over our state to highlight the impact of Trump's failed coronavirus leadership, his ongoing war against folks with pre-existing conditions, Medicare and Medicaid, and his failure to lower the cost of prescription drugs, in contrast with the leadership of Democrats in the House and Senate. Listen, the contrast between Trump and his Republican colleagues in Congress and Vice President and Democrats in Congress couldn't be more stark. This November, your healthcare is on the line. So with that, I would like to introduce ERIN GABRIEL.
Good morning. Thank you, Tim. My name is ERIN GABRIEL. I am the Director of Advocacy for Little Lobbyists. I'm also the State Chapter Leader for Little Lobbyists Pennsylvania. More importantly, I am Colin, Bridget, and Abby's mom. You can see their picture here. We're in Beaver County in Western Pennsylvania. My youngest daughter, Abby, is a beautiful, fun, mischievous 10-year-old who loves playing with her big sister and brother, going to the theater, exploring the outdoors, and of course, all things Disney. Abby is deafblind, autistic, and has a rare progressive neurological syndrome affecting multiple organ systems. She is considered very high risk for COVID-19. So today marks 189 days since Abby has been inside any building that is not our home. It has been 193 days since she has been to her beloved school. Summer vacations, play dates, outings, travel plans to visit our grandparents, they've all been canceled. Last month, we had to make the difficult decision to actually pull Abby out of her school officially. It's a place that's become community and home to her over the last 8 years, and we're now homeschooling her. She, like many children with disabilities, simply cannot access a virtual education, and it's not safe to send her back into a school building while the virus is still spreading. But Abby misses her school and she misses her friends. Normally, going to speech and occupational and physical therapy help Abby to keep the progress she has made, learning to walk, eat, swallow, and communicate. But with COVID-19, they've all come to a halt. It's just not safe. Abby's syndrome is progressive. She will eventually lose much of what she has gained, and we are already watching some of that play out. Her seizures will return and intensify, her muscles will weaken, and her spine stiffen. And as her disease progresses, we know that she will need more intensive medical care. Attending school and receiving in-person therapies is one way we have tried to stave off that potential progression. And I worry about what she stands to lose by not being there right now. She's been robbed by an administration that not only failed to act, but blatantly lied about what they knew. Robbed by a president more concerned with his own poll numbers than with the numbers of infections and deaths in our communities. And while the president is forcing schools to open without regard to safety, and even encouraging my neighbors to skip the mask, he is also in court trying to repeal the Affordable Care Act, trying to take healthcare away from millions of Americans in the midst of a pandemic. All 3 of my children have disabilities, and they rely on the protections of the Affordable Care Act to access their care. But kids get sick and need to see a doctor outside with disability as well. Kids fall off their bike and break bones, and sometimes they catch a baseball with their face instead of their glove. Life happens, even during a pandemic. When my son Colin was 12, we were out with one of his friends, and he had a sudden severe abdominal pain. So bad, in fact, that we wound up taking him to the emergency room at Children's Hospital. As a disabled child in Pennsylvania, he had both private insurance and Medicaid, so I didn't hesitate. and I didn't contemplate the cost of the visit, as some families would. As it turned out, Colin had appendicitis, and if we had waited another day, his appendix would have burst, causing a much more dangerous situation. He was admitted and his appendix removed, and again later that week when he developed some complications, we, as directed, went right back to the emergency room, worrying only about my son's health and not about how we would pay for groceries afterwards. Without Medicaid and health insurance, we would have hesitated, and far too many families are forced to do just that. They second-guess themselves, worried about the cost, and delay treatment. In this time of great uncertainty, our families, all our families, need the certainty that if they or their child needs care, that they can get that care without losing their home, especially now. And instead of offering that certainty, the president is in court trying to rip healthcare away from millions. Our kids are missing out on so much of their childhood right now, and instead of acting to mitigate this virus in our communities, instead of showing true leadership, this administration is trying to force schools open without adequate safety measures. Also, the president can perpetuate a myth of normalcy in the midst of deadly chaos. And all of this was preventable. It didn't have to be this way. Our children deserve so much better. Thank you.
Oh, thank you, Erin. With that, I will introduce KRISTIN URQUIZA. KRISTIN?
Thank you, Tim. And Erin, it's so great to meet you and hear your family's story. Thank you so much for all of your advocacy work. My name is KRISTIN URQUIZA, and I'm co-founder of Marked by COVID and also an advisor to Protect Our Care. I find myself in this universe very recently. 6 months ago, I was an environmental advocate finishing grad school, thinking about 2020 and beyond as an opportunity to really tackle the climate crisis as my main goal. However, in late May, when the state started to reopen, my dad ended up contracting coronavirus. And after 3 terrible weeks of pain, suffering, and loneliness, he died. My dad was an otherwise healthy, exuberant 65-year-old who was looking forward to my rescheduled graduate school graduation and coming out to visit me, but found himself caught in this universe of lies and misinformation that's been coming from the White House all the way down into state and local governments across the country. And make no mistake, this is led by the President of the United States, Donald Trump, who is taking our lives at such risk with his decisions. He has failed to protect the people of the United States. He has failed to make decisions that benefit our public health, but really putting his own political agenda above our families, our parents, and our children. He continues to downplay the virus, as we've seen just in the course of the last couple of days, in deciding to make campaign events in Nevada and Arizona, where he's inviting supporters to come indoors without social distancing and without masks. He is promoting super spreader events while we are in the midst of a pandemic, while he's also trying to take away our healthcare. He's rushing to reopen schools. He's continuing to discourage people from wearing masks, and we are continuing to fall behind when it comes to testing, contact tracing, and other mitigation strategies that we know works when it comes to tackling this virus. This is one of the reasons why I've partnered with Protect Our Care over the course of the next couple of months to help spread the word that when we play with our care, it is a life and death situation. I know this far too personally. Losing my dad to this terrible virus was the most awful thing that could have ever happened to me and my family. I think about him being alone in the hospital, not being able to have his family around him when he passed. And I would not wish that type of death upon my worst enemy. And so that's why I'm here, to ensure that people know that this November, we are thinking about healthcare when we go to the ballot, and know that Donald Trump has no care for the US population. Thank you.
Thank you, KRISTIN, and thank you, Erin, again, for your powerful stories. With that, I'd like to introduce Congressman Matt Cartwright.
Well, thanks, Tim. I'm in my car outside the Capitol right now, off of Capitol grounds, and I was glad I got on to hear those stories from KRISTIN and ERIN. So important. And ladies, our hearts go out to you, and you're in our prayers. Um, it's hard to overstate the importance of healthcare, isn't it? I mean, I've been in the Congress for close on 8 years now. I ran on defending the Patient Protection and Affordable Care Act. I think about the people who have pre-existing conditions and how many of them, even where they had healthcare coverage, they were strapped to their jobs. They dared not look around for different employment for fear of not having their health care picked up by a new employer or by a new policy. 130 million Americans have pre-existing conditions, and that includes over 1 million people in Pennsylvania. We can't go backwards. We can't leave these people behind. I came at it with a history of serving on the board of directors of a hospital. It was a small hospital, and I was on there for about 7 years. It was long enough for me to wrap my head around healthcare finance, and here's what we found out, what I found out. Hospitals have to give out free medical care. If you show up bleeding to death at a hospital, it's the law that they have to stabilize you. And they end up giving an awful lot of free medical care out because of people who are uninsured. So if you think about it, who pays the price for great numbers of uninsured Americans? It's the hospital system. And before Pennsylvania accepted the Medicaid expansion that came as a part of the Patient Protection and Affordable Care Act, I had 2 hospitals in my district closed down. St. Catherine's Hospital in Schuylkill County and the Marion Community Hospital in Carbondale. We can, it's when you talk about healthcare coverage and insurance coverage, everything's a little bit theoretical, isn't it? Am I ever actually going to need this coverage is a question that occurs to some people. But look, when your local hospital closes down, there's nothing theoretical about that. If you're having a stroke or a heart attack and they have to get you to the emergency room ASAP, it makes a huge difference in the outcomes, how long you have to travel to get to the nearest hospital. The neurosurgeons use the expression lost time equals lost brain cells in the stroke situation. So if it changes from 8 to 10 minutes to the local hospital, from that to 30 or 40 minutes, there's nothing theoretical about this. And that was one of the big reasons I supported the ACA, and I still do. We don't want to move backwards. And yes, there's this, Bill Barr, our intrepid Attorney General. I'm on the appropriations subcommittee that funds his Justice Department. And I asked him flat out last April, the default position of an Attorney General of the United States is to defend the constitutionality of duly elected statutes of our government. And he has turned this on its head, and instead of defending the constitutionality, they're attacking it, and they want to get rid of it. And I asked him, Attorney General Barr, what is your plan for taking care of 130 million Americans with pre-existing conditions if you win this case? And he said, oh, well, that's not our department. We're the legal department. And he gave me a couple of other flip answers like that. That doesn't cut it. We're talking about life and death for people in this country. And either you care about them or you don't. Either you share our values or you don't. And I'm sick and tired of people like Bill Barr and Mitch McConnell who don't care. And, they're promising some plan to take care of pre-existing conditions. The plan doesn't exist. It's so it's all just smoke and mirrors. They're all going back to, they want to have it the way it was before, which is the Republican plan, and that plan is you're on your own. I got mine. You worry about yours. Um, so, and then in this COVID crisis, I mean, almost 4 months ago, we passed the HEROES Act. And part of that HEROES Act is money for testing and tracing and treating and getting this virus under control. You know, there's a reason we have a border problem in this country, and the border problem is on our northern border. Canada will not let Americans into their country. You know why? They don't trust our response to COVID. They don't trust that we're not sending people who are infected into their country. What a statement that makes. And there's 27 countries around the world that refuse to admit Americans right now. We need to take a leadership position on healthcare in the world. We don't need to be the ones forced to sit in the corner because of our bad behavior. So I'm here to say thank you to the folks pushing Protect Our Care. You know I've been with you all along, and I'm not going to stop now. Thanks very much, everybody. Back to you, Tim.
Thank you so much, Congressman. With that, I will introduce Senator Bob Casey.
Hey, Tim, thanks very much for organizing this call. Thanks to Protect Our Care. And want to say hello and extend my thanks to my congressman, United States Representative Cartwright, for his leadership on these healthcare issues for years now, running against often the tide when the Republicans had a majority in the House, and now, of course, demonstrating leadership as a member of the House Democratic Caucus, which thankfully is in a majority position to stop and to push back against the dismantlement of healthcare that the Republicans have undertaken. With respect to the congressman, and I hope with respect to me, I would say that the two most important voices on this call, of course, are ERIN and KRISTIN. And I hope we can all get a copy of, if they have a written form of what they provided today by way of testimony. I'd say to the press, if you make no reference to me or to the congressman, please report in the stories about this call what KRISTIN and ERIN told you, because it's the best evidence, the most compelling testimony as to why healthcare is such an important issue this year and why it's been so important the last number of years under the Trump administration. Because when you consider, just when you step back and look at where we are with the terrible virus and the impact of the COVID-19 disease, there are a couple of facts that are irrefutable. One is that the United States has about 4% of the world's population, and at last count, 21% of the deaths, and more than 20, it could be as high as 23% of the cases. That indicates a failure by this president, by the administration, to deal with this health crisis. It happens to be the worst public health crisis in a century, and the president has failed. Now we know a lot more about what he knew when and what he was saying when he was lying repeatedly about the severity and the gravity of this public health crisis, over and over again, misleading or outright lying to the American people about the virus. But many would say, in light of that record of failure on the virus, that the president, and I think when they say this, they'd be speaking the truth, the president has no plan to tackle the virus, still does not have a plan to tackle the virus. He also has no plan to create the millions of jobs that have to be created and others that have to be retained over the next couple of years when this jobs crisis persists. So he has no plan to tackle no plan to create the jobs we have to create. But unfortunately, he does have a plan on healthcare. His plan is very clear. It's to destroy the Patient Protection and Affordable Care Act. That plan that he has supported is now in play in the Supreme Court. The Supreme Court is in the midst of beginning the deliberation on the Patient Protection Affordable Care Act. It could declare it unconstitutional. Of course, the effect of that would be to not just destroy the law, but to take away all protections for pre-existing conditions. So that's the president's plan. He's got a second part of his healthcare plan. The second part of the Trump Republican plan is to cut Medicare and Medicaid by hundreds of billions of dollars over 10 years. That means in any one of those 10 years, Medicare and Medicaid would be cut under the Republican budget proposal. This again is the official position of the National Republican Party, to cut Medicare and Medicaid by tens of billions, probably at least 50 billion each and every year for 10 years. Why do I know that? It's because it's in their budget. Now, they haven't been successful yet, but if there is a second Trump term, for this president, that's where they're going to go. They want to destroy the ACA, which means Medicaid expansion ends, and it means that they're going to make efforts or undertake efforts to continually cut Medicare and Medicaid by tens of billions each and every year. Now, why should Americans be supportive of the Patient Protection Affordable Care Act? Because this law has helped every American in one way or another. Sometimes directly because folks got coverage through the exchanges, or got coverage through Medicaid expansion, or got further protections which they did not have before because of the protections in the law, including for pre-existing conditions. We know that 1.1 million Pennsylvanians got health care solely through this law. We know that tens of thousands of Pennsylvanians, and a much bigger number nationally, got help for a substance use disorder problem. A lot of them for an opioid addiction. They would not have gotten that help absent the expansion of Medicaid. We know that. It also helped rural areas in several ways by making sure that kids have health care coverage and families do, but also the Affordable Care Act stabilized the revenues of a lot of rural hospitals, like we have in 48 of our 67 counties that happen to be rural counties. So the benefits to the Affordable Care Act are multiple. The efforts to undertake the sabotage and the destruction of the Affordable Care Act are multiple as well. The Republican plan from the beginning has been about the destruction, the dismantlement, and the defunding of healthcare, especially the ACA, Medicare, and Medicaid. It's very important that we continue to work to stop them, not to negotiate with them on how they're going to destroy it, to stop them at all costs. That's what I'm going to continue to do. And if they want a long and rough fight on this, that's what we're going to do. We're going to fight and fight and fight to stop these people from trying to rip away healthcare from so many families across the country. Thank you.
Thank you very much, Senator Casey. And thank you again to everyone who spoke. At this point, I'd like to open it up for questions and answer period. Attendees can enter questions into the Zoom chat box or into the comments on the Facebook Live event, or you can also raise your hand and Mitch from Protect Our Care will call on you. So I'll give everybody a second to do so. And then Mitch, do you want to open it up to folks?
Sure thing. Hey everyone, this is Mitch Harrell with Protect Our Care. Like Tim said, you can either put a question into the chat box or raise your hand here on Zoom and I will call on you. So if you have any questions, please do that now. Tim, it doesn't look like we have any questions right now, but if our speakers have anything else they want to say before we close, I think we can open it back up.
Sounds good. Any closing remarks?
Can I ask a question to both KRISTIN and ERIN? Can we get copies of what you said today?
Of course.
Yeah,
Thank you.
absolutely. And
So
thank
then we can
you so
just
much.
read what you said and we won't have to say anything more.
Well, thank you so much, Senator Casey, on your leadership on these really, really important issues. I know it's pushing a boulder uphill, but it's a worthwhile cause.
Thank you.
And I'd like to also express my thanks to you, Senator. You know, you're my favorite senator. I always say that. But genuinely, it's really, it's reassuring to have somebody like you fighting for my kids in DC every day. And it's just, especially right now, because it just feels like the whole world is against us. It's nice to know that we have people like you and your staff fighting for us. So thank you.
Thanks. And I'm lucky to be represented by Matt Cartwright, who has been fighting these battles for a long time. And we're grateful for that. But thanks to both of you for your testimony today.
Well, with that, I will close out the call. Again, thank you so much to everyone who joined us today. Thank you to ERIN and KRISTIN. Thank you to Senator Casey, and thank you to Congressman Cartwright. I really appreciate your time and your stories today. Thank you so much.
Thanks, everybody.